Hello, I'm Dr. Fred Venditti. I'm the Hospital System General Director here at Albany Medical Center. I'm joined today by special guests, Diane Shagru, the President and CEO of Glens Falls Hospital. Let's go to the numbers. The first up on the screen, you see our usual Capital District area numbers. And you can see that the number of admitted patients across the capital region is pretty much unchanged, as it has been for most of the summer. The second graph that's up there for you to see are the admissions and discharges here at Albany Medical Center. We've not had any deaths in the last few days, one or two admissions and a few discharges. The final graphic that you'll see are the admissions in the hospital at the moment, the census, and you can see that we have 12 patients in the hospital. 3 of them are in critical care, and for the first time in a while, Diane, we actually have 2 patients on ventilators in our intensive care unit. So really kind of status quo here at the medical center from a COVID perspective. Tell us a little bit about what's gone on in the North Country as it relates to COVID.
Yeah, sure. Presently, we have been between 0 and 2 patients a day, probably running that trend since the end of May. In Warren and Washington County, we're seeing very little COVID activity, thank goodness, and we're happy about that.
That's great.
Which doesn't mean that we're not 100% prepared to ramp right back up if we need to ramp up, and we're hopeful that that's not going to happen again. One of the things that was very helpful during some of the very difficult early days of this pandemic was being on a daily phone call with Albany Medical Center and all of our other hospital colleagues in the Capital District and even beyond up into the North Country. And that really was very helpful so that we all had the same policies, procedures, and we weren't all reinventing the wheel. So that served our community really well.
I think you're absolutely right. I think it was helpful to all of us, all the institutions that participated, and we still do that call on a weekly basis just to keep tabs on things. The medical center has done a lot of testing. I just wanted to say a little bit about testing. We have actually tested 17,500 people for COVID. It's kind of a large number. Interestingly enough, only about 2.6% of them have been positive. And that number goes back all the way to March when we first started testing. So that includes our pre-op patients, it includes the tent that we used to have, people driving through that for testing, as well as inpatients and others that we've tested here at the medical center. For those patients treated in our emergency department or admitted into the hospital, there were about 5,000 of them. And interestingly enough, that positive percentage was about double the other at 5.9% positive. So both relatively small numbers, tested a lot of patients, found some COVID, but not as much as in some of the hot spots like New York City. So just wanted to share that with the audience. So Diane, Glens Falls now has become part of the Albany Med family, joining us as an affiliate. Tell us a little bit about that.
Hallelujah is my first word. It's been a long journey. The actual talking to Albany Med on a formal basis and all the due diligence that both Glens Falls went through and Albany Med went through, it was 2 years and 10 months from when Glens Falls Hospital began to look for a partner up till selecting that partner, and then all of the, as I said, due diligence and legalese that comes after that. On July 1st of this year, is that 48 days ago, I think?
Yes.
Not that I'm counting. We became an affiliate of Albany Medical Center. So now when I introduce myself, I'm proud to say that I'm the president and CEO of the Albany Med Health Systems Glens Falls Hospital. It's a mouthful, and I've stumbled over it a few times, but I'm practicing it. So we're really all very excited to formalize a partnership that, honestly, I've been at Glens Falls for 13 years. Albany Med has always been our partner. They've always been our clinical partner. We've done an awful lot with them with our OB program, perinatal program, with our cardiology program, helping to provide coverage for us. On average, I think we've said, we send about 3.5 patients a day from our emergency department down to Albany Med. That's always been. I think we'll continue to do that. And it was really a sort of a no-brainer. I think everybody did all their due diligence, but when it came right down to it, it was the logical partner. Albany Med has been Glens Falls Hospital's partner, and Glens Falls Hospital has been Albany Med's partner forever. So it formalized an informal partnership. And, you know, I have to say, that was one of the main reasons why I think that Albany Med ended up being the selected partner for Glens Falls. That and the fact that we could pick up the phone, we call Albany Med, and Albany Med always says, whether it was 13 years ago, 3 years ago, or today, what do you need? How do we help you? And Albany Med has always been there to help us provide adjunct care to our community, which has been tremendous. And that is what we hope to have happen through this partnership, to be able to make sure that we can provide health care to our community and that we utilize additional expertise that we get by being part of this large health system.
So Diane, when I first came here 21 years ago, I was practicing as a cardiologist. So I know you're a cardiologist, and actually a lot of the other physicians quite well up in Glens Falls. They're a tremendous group of physicians, and you're absolutely right. There's been a tremendous amount of sharing of patients back and forth, not just in that discipline, but in other disciplines. And we appreciate the good work that your physicians do, and they appreciate our good work as well. So from a clinical perspective, it certainly made a lot of sense. Diane, how are the rest of the staff at Glens Falls viewing this?
Everybody's pretty excited.
That's great.
You know, we all know that healthcare is changing every day, and it's not an easy road for any of us. Independent, small community hospitals, there are less and less of those, and really we know that in healthcare, scale is better.
Yes.
So as we were, we knew we needed to find a partner for the main goal of making sure that we're going to have healthcare in the North Country today, tomorrow, and into the future. The staff, honestly, they're thrilled. I think one of the challenges for us in these first 7 weeks has been sort of slowing us down. It's sort of like, okay, we can do that. We like to do that with you. The more we can be integrated, the better. And we recognize that, you know, you join a system and you have to figure out where everybody is in the system and how fast a thing's going to integrate. But there is this willingness to want to partner in any way that we can, particularly also around the fact that we all know that there are less and less people going into healthcare, some of the very difficult to recruit jobs. How do we use our resources together to be able to provide care to our community when the resources continue to shrink? I think it was interesting in our emergency department. There's many people have worked there for the providers have been there for years and years and years. And many of them know Dr. McKenna. And Dr. McKenna knows our emergency department and the layout of it because he has done some clinical shifts there. So it's really sort of like an all in the family coming together. Really the community, the external to Glens Falls Hospital, the staff at Glens Falls Hospital, the medical staff at Glens Falls Hospital, everybody is pretty excited. I think it took so long, that 2 years and 10 months, that's why people were saying hallelujah and breathing an exhale like, great, we're part of the largest healthcare system in our area. You know, I was talking today, we go from the upper Hudson Valley all the way up into the Adirondacks. So when you look at the Albany Med Health System, which we are now proudly a member of, that's a lot of geographic territory that this health system now it controls, if you will.
Yes. So Diane, you know, I know you have a lot of things on your list that you want to get accomplished. We're really happy to have you in the Albany Med family. So congratulations on joining us. A lot of hard work, I'm sure, went into getting to this point, but we look forward to our future together. So that's it for today. Obviously, I'm not Dr. McKenna. Dr. McKenna is away this week. I'll be here again on Thursday with another guest co-host, Kate Keefe, one of our AVPs for nursing. But till then, take care of yourself and take care of each other. Thank you.